so I didn't take it today. And that's especially true with people on high blood pressure medication. I remember years ago I was doing a health fair when I worked for United Healthcare, and I took this gentleman's blood pressure. It was 208 over 110. Anything above 130 over 80 is considered high blood pressure or hypertension. Well, as soon as I took his blood pressure, I said, look, your blood pressure is extremely high. Call your doctor immediately and tell them what your pressure was. Well, instead of doing that, he went and had a sandwich. And of course, we know deli meat is full of salt.
Right.
So whatever his blood pressure was before, it had to go up. And the same thing happens too with people with diabetes. They figure, well, I feel okay, so I won't take my medicine today. And to be honest, some medications have side effects. But you got the medication for a reason. And if you go off of it, or if you change the dose, it should be in conjunction with your doctor or your pharmacist, but you should not do it on your own. Also, we talk about getting a support system too, because a lot of times diabetes is related to either stress or depression. Some people become depressed because they have diabetes. Some people have diabetes and then become depressed. So there's a bilateral sort of thing going on between the two.
Yeah,
right.
Yeah. So your organization sounds like it also offers that kind of support.
Well, we encourage people to also attend whatever other programs are in the community, and there's a lot of diabetes education programs in Hawaii. In fact, there's more than 100 certified diabetes educators who are all clinicians. They could be physical therapists, nurses, dietitians, doctors, nurses, and we don't claim to be the only resource to get education, but we are the gateway to direct people to other places.
Okay. Well, what would you say makes your program unique, if anything?
Well, I mean, there's two things. Number one, it's free.
Okay.
And we are one of the few programs that will actually come to the site rather than have you come to us.
Right.
And for a lot of people, that's an incentive.
Is there a minimum number of people that you require to have a class?
Well, I did a class with one person in Kapolei, and we've had classes as large as 30, 40 people. Now, obviously, the one person gets more individualized attention than a group of 40, but still, getting the information is the first step, and of course, using the information is the second step.
Right.
But there's also a maintenance too, because the studies have shown that even when people are educated, even when they've changed their behavior, there can be a slacking off after about 6 months to a year or two. So people need the reinforcement because the disease doesn't go away. So if somebody ever says they used to have diabetes, that's not true. Like any chronic disease, you live with it. Now you may get it under control, and that's what we hope for. But it doesn't mean you're out of the woods, because if you go back to the same kind of behaviors that caused you to get diabetes in the first place, you might end up right back where you started.
So I have a nephew who is just over 10 years old now, and he's pre-diabetic. So they're watching his diet and so forth. But when you say you have to maintain your your health so that you don't fall into getting diabetes, I mean, how does a young child continue to do that throughout his whole life?
Well, it also depends too on what type of diabetes, because there's type 1 and type 2. Do you know if your nephew was type 1 or type 2?
I'm not sure.
Well, type 1 is what they used to call juvenile diabetes, because it primarily affected young people. And type 2 used to be called adult onset diabetes because it generally affected people, say, in their 30s, 40s, 50s, and beyond. What we are finding, though, is that in some cases, in rare cases, you get some older people